This is Speaking of Pets podcast, where we give you up-to-date, accurate, science-based information when making decisions about your pet's health.
From experts in dermatology like my sister, surgery, internal medicine, CBD use in pets, the pet food industry, you name it. If it affects pets, we'll talk about it.
Today's Speaking of Pets podcast is sponsored by Blue Buffalo, the maker of natural pet foods. Love them like family, feed them like family. Blue Buffalo offers wholesome, meat-first recipes with high-quality natural ingredients in flavors dogs and cats love. Discover formulas for all breed sizes, life stages, and lifestyles. And with Blue Buffalo's True Blue Promise, that assures that real meat is the first ingredient, with no poultry byproducts, no corn, wheat, or soy, and no artificial flavors or preservatives. Hey, Janet, what's going on with you today?
Well, big news is that we have a major outing on I-95 going north, which has shut down traffic all over the place. So it's been hell.
Oh, yeah, you sent me that, but I was doing something so I couldn't read it.
Yeah.
Hey, we just did the two-day drive back from Florida, and we lived. And Capri, my 21-year-old cat in renal failure, she always is kind of like when we get home first, but now she's better and well-adjusted, and she's on her porous wand and her amlodipine and her special food. So she's hanging in there. And of course the girls, the Goldens, were so happy because I opened the gate and they were zooming for 10 minutes.
Well, you tell Capri, I said,
I know. She only got me up a couple times last night. So, when people ask me what I do, it's like let out the dogs and check the cat every 2 hours. So.
Oh, we call ourselves the servants.
Oh, of course. Born to serve.
Servants.
Anyway.
And so we had, for excitement this year, today, when was it?
Okay.
2 days ago. We had 2 chipmunks dead in the backyard, a big one and a little one. And then to top it off, I see Libs rolling in something, and I go over, and it was just the rear paw of the chipmunk and a tail. And then we had Mr. Turkey, who's courting Mrs. Turkey in the front yard.
Yeah.
Mr. Turkey looks like the NBC peacock. And I don't know if you know this or not, but the gobbler becomes engorged and bright scarlet red.
Okay, and let me just say
excited.
this. Turkeys also are vectors of ticks, and they're hard to study. It's small mammals and of course deer and turkeys. But I'm so happy because we have a very special guest today and such a wonderful friend of mine, Dr. Liesl Bigge. Liesl is a vet school graduate of The Ohio State University, which we're going to get into. We wore our Buckeye stuff for Liesl. She did her internship, Janet, at Darien Animal Hospital out by you in surgery and medicine, then went on to Tufts to do her residency. She is currently co-owner of Cleveland Associated Veterinary Specialists and an internal medicine consultant for one of our large veterinary laboratory companies. So Liesl is a fellow Buckeye, and we have to show all of her Buckeye-ness because Dr. Rusty Moore, our dean, is going to be envious of all her stuff. Welcome, Dr. Bigge.
Hi,
Welcome,
thanks for having me.
I know it was Dr. Liesl, as Alice would refer to you.
Yeah. Let me call Liesl. Oh, and Liesl, I forgot to tell everyone this. She still lives on LeBron James Street. Janet, remember, did I ever take you past LeBron's house in Akron?
Oh, yeah.
Yeah. Well, Liesl lives there. Remember I told you there's Liesl's house.
Right around the corner.
On the left. Yeah.
So do you go over and borrow like a cup of Grey Poupon on occasion?
No. They're not here very often.
So he still owns the house.
He still owns it. They still keep it up really nice. They decorate for holidays, maintain the property. But he's not home. I mean, he comes home for Thanksgiving. They have had parties, for their kids and stuff. And then we don't see him very often.
Yeah.
Because, I'd go knocking on his door because I want that cryo machine, that tank. Does he have the cryotherapy tank?
I don't know. I mean, I know he has a bowling alley, an indoor and outdoor swimming pool, a barber shop.
As do we.
Yes. Car wash.
I'm going to point out the Buckeye chair. See
okay.
Chair?
So there's the Buckeye chair.
And the quilt.
And the quilt that my mom made. Let's see if we can get that up.
And the
That
other
is
item too,
real
Liesl.
Buckeyism.
Sure.
Wow.
Yeah, my mom's a fabulous quilter. And then this was created by my mom from some old drapes that I actually
Surgical
don't know.
drapes.
Surgical drapes. I'm not sure where I actually got
Oh
the
my
surgical drapes
gosh.
from, but
That is so
That is
cool.
so
isn't
cool.
that fun?
Yeah.
Exciting.
Anyway,
Wow.
Wow, Mom
so
is
that hangs
talented.
in my Buckeye bathroom actually.
Janet, you thought you had a lot of stuff. Hey, here's the other thing. I'm so glad we have an internal medicine specialist on today because we've been getting so many questions on the Facebook page. And so, Liesl, we'll probably have to have you on again because I don't think we can cover all this. The first one that someone asked about, they have adopted a golden retriever from rescue that has megaesophagus. And if you
Wait,
could explain a little about what
wait.
that
For the real
is.
people, what's a mega? What's a mega
Okay, Liesl, you're on.
big?
Okay. So mega means what it sounds like. Like megamaniac, megalomaniac means big. Okay. And so the esophagus in the rested state or when we're not swallowing is really pretty flat. You know, the two sides of it basically are collapsed and flat together. When we eat and swallow, that bolus or that chunk of food goes down the esophagus, and the esophagus opens just to accommodate that part of food, and then through peristalsis squishes it down into the stomach. What happens in megaesophagus is it's basically just a descriptive term saying that the esophagus is too big. You know, it stays large. It lacks the peristaltic motion that it's supposed to have, or the ability to get that bolus of food or that chunk of food down into the stomach. It's a frustrating, difficult condition, and there's several different reasons for it, most of which we actually don't diagnose the actual cause for it, which is when we default to a diagnosis of idiopathic megaesophagus. Idiopathic just means idio, stupid, we don't know. And then path is where it comes from. So I'm not sure if that's the technical Latin definition, but idiopathic megaesophagus is what
So
we
how do you,
we call it.
you don't fix it, but what does the pet owner, how do they help their pet?
No. So most often it's a management situation where we will recommend feeding a food consistency that the dog does best with, which kind of sounds, well, that's sort of obvious, but that might be meatballs of food. It might be a gruel type food. Very rarely is it ever a straight liquid type diet. I've had people that have taken the like loaves of dog food or pate type dog food and mix it with canned or with kibble, dry kibble to feed them. But one of the most important parts, besides just feeding diet consistency, is the position in which the dog is when it's fed, which is literally we want the esophagus to be vertical. So what we do is we have the dogs be in almost like that begging position, and that can be accomplished with little peanut-sized dogs. You can accomplish that like by putting them in a baby carrier in front of you. And then you feed them in that position. And then you walk around for 20 minutes to a half an hour with the dog in this completely upright position. With a big dog, like a golden retriever, we recommend using what's been described as the Bailey chair. Like Bailey, like a dog's name is what it came from. And there were some great people many years ago now, probably maybe 25 years ago or so, that devised this contraption, which you can get plans for online. They can either build them for you or you can build them at home, which allows the dog to sit in this upright position, and you feed them like that and leave them there for 20 minutes, and you let gravity do the work of getting the food into the stomach.
Wow.
So there's no medication for it, right?
There are a few that we've tried that some folks, depending on who you talk to, will recommend. One of them is sildenafil, which is, Alice, you can talk about what sildenafil is, right? Being the pharmacist that you are. It's Viagra, right? And some people also will recommend using, we'll just say Propulsid, using that. I don't really think that does very much. I think sildenafil probably does help somewhat, but it is a management thing. It's a tough disease because these guys have a propensity towards the development of aspiration pneumonia, which is where because this esophagus doesn't keep everything down where it's supposed to, it kind of sits stuff, food and water will sit in the esophagus, and then the dogs will regurgitate, that, and if it doesn't make it all the way out of their mouth and it goes down their trachea, they can aspirate or breathe that in and then cause nasty inflammation in their lungs. And that oftentimes is what leads to euthanasia of the pet if they've had recurrent bouts of aspiration pneumonia, and it's just getting to be very difficult to manage the dogs. But it's a manageable disease, but long-term, it's tough. It's hard. It takes a lot of time.
Is that why some people have those dog bowls with the spikes? Where the dog eats
Well,
slower?
I think the spikes in dog food bowls are mainly to slow down the speed at which dogs eat. So if you have dogs that have a tendency towards bloating or bringing a lot of air when they're eating, and causing their stomach to distend, some people will feed that way just to slow the dogs down more than anything else. So it really doesn't have anything to do with megaesophagus, really.
Okay.
I know some of the megaesophagus pet owners have a Facebook page, which I think is great, where they can trade off suggestions and how to build the chair. And but it's very sad because I remember the one rescue owner had emailed me, and I think they went to Ohio State and got diagnosed there because I think they do fluoroscopy, right?
Yeah, so fluoroscopy, which is essentially a motion picture X-ray, is one of the ways that we can diagnose it. It's the fancy way to diagnose it, but oftentimes it's fairly obvious on regular X-rays. And sometimes we can also give a thick type barium, which acts as a contrast agent. There's one that's called esophatrast. It's like a kind of a toothpaste consistency that will coat the esophagus and allow us to see it on just plain films. So it is one that can be diagnosed fairly easily by general practitioners if they're clued into thinking about it. Because oftentimes the pet will present with the owner saying that the dog's been vomiting at home, but there's a big difference between vomiting and regurgitation. And what happens with a megaesophagus dog is they're actually regurgitating versus vomiting. Vomiting means that that stuff that's in the stomach itself is being thrown this direction, and they usually have very large belly, stomach components, contractions to propulse that in this direction. With regurgitation, it's almost a passive event. The dog won't have any belly contractions, and then all of a sudden, food will come up. So it's there's a difference between the two, and if the veterinarian hasn't seen the dog do what it's doing, and the owners don't have a video of it or haven't described it as such, then that can be mistaken. People might be taking belly x-rays and then miss the fact that the esophagus is distended and has a problem, but we get there eventually.
Videos, boy, that's a lifesaver. Because when an owner's trying to describe something to you, like the difference between fainting and an epileptic seizure,
And
and if that's on camera, that's so helpful to us as veterinarians.
In fact, I was a friend of mine was texting me a couple days ago, where she has a 12-and-a-half-year-old little terrier that she said, Liesl, can you help me with this? I don't know whether I should take her into to the emergency clinic or not, but she never refuses food, and she, refused food and went and hid in the office. I'm like, okay, well, what's she doing? She's like, I don't know. Something's just wrong with her. I said, well, why don't you take a video? And so Patty takes this video of her pet, and it literally was having these big belly contractions like it would with vomiting, but then wasn't exposed, passing anything forward. So that was what helped me to say, okay, yeah, there's definitely something going on in her abdomen. It's not a breathing issue, which sometimes big belly movement can indicate a breathing problem. And then, said, yes, you need to go to the emergency clinic. And unfortunately, she has an abdominal mass and is scheduled to go to surgery early next week. So
What is it? Is it splenic?
No, it's actually small bowel, small intestine.
Wow.
So fingers crossed that we can get that completely resected and taken care of by little Chloe. She's the best.
We talked to Dr. Gamlin last week, And I wanted to ask you about this because I get asked, even though I'm a dermatologist, I get asked about this. His 14-year-old dog had what sounds like idiopathic vestibular syndrome.
Mm-hmm.
Can you talk about that a little bit? And do we know the cause or what are causes? And
Idiopathic vestibular disease, we don't know. And I'm not a neurologist. I'm an internal medicine person, but we certainly deal with neurology cases, especially since you think there's not a lot of dermatologists. There's a whole lot less neurologists, right, veterinary neurologists than there are, internists and such. But it has this term idiopathic, meaning we don't usually understand the reason for it. Vestibular disease, the vestibular system in dogs and in people is the system that controls balance. Okay, so it not only has to do with the semicircular canals, or the things in your ears that when you're a little kid and you spin around in circles and then you're dizzy and you fall down, that's because the fluid in your semicircular canals is moving around. And if there's a problem in the inner middle ear, or a problem in the nerves that are going from that inner middle ear to the part of the brain called the cerebellum, we can see vestibular signs in that whole system. With old dog vestibular disease or idiopathic vestibular disease, the problem typically is what we call peripheral, meaning it's not a brain disease, it's not a cerebellar disease, but it's a disease that has to do probably with inner middle ear or the nerve, from the inner middle ear to the brain. The dogs look like they've been spinning around in circle and are dizzy, so they'll have a head tilt. Sometimes their eyes will flick back and forth. They usually don't have problems with their ability to know where their foot placement is, what we call proprioception, but oftentimes they're not able to walk because they're so dizzy. So we have to, as veterinarians, have to determine, does it seem like it's a central problem when these dogs come in dizzy, or is it not the brain and actually a peripheral problem, which is actually better, because usually the peripheral disease or the old dog vestibular disease situations, the dogs improve just with time. Sometimes anti-nausea medications, meclizine, which is used for vertigo or dizziness in people too, and time and supportive care. So
Janet, you had that, didn't you?
I had vertigo. It was terrible. It was
it's
I'm going to put it in layman terms. I was at a yoga class and it was the ear rocks got loose, the little crystals in your ear, right? And they're floating around and I love it. I went to the emergency room and the doctor said, it can last 10 hours or 10 years.
Mm-hmm.
And they did the Epley maneuver.
On the table, the tilt tab.
Well, they do, like you tip your head around and you're like, oh my gosh. And eventually it just kind of dissipated, but it comes on and you'll be driving the car and you have to stop because the whole world, it's not like dizzy, it's a different movement. But I can't imagine a pet not being able to explain that, when it's happening to them. That must be terrifying.
Yeah, it's difficult. They're scared usually. And I think when I've dealt with there was one case I remember as an intern at Darien Animal Hospital where the pet was so dizzy, and it was before we have some better drugs nowadays that we can use for treating these guys. There's a newer veterinary drug called mirapatent, the trade name is Serenia, that actually works really well with vestibular dogs to control we think it controls the nausea that they feel, but at least it stops them from vomiting, if they do feel nauseous. But we ended up having to put a feeding tube in the dog's neck and feed it because it took so many weeks for it to resolve, for the clinical signs to resolve. That's the only way we could feed the dog. And the dog was laying in a cage it looked like a pretzel in the bottom of the cage. And we literally would let it stay like a pretzel. And we would slowly feed it, through the esophageal tube, just so that we could get the nutrition into it. Because if we tried to make the dog upright and put it in a normal eating position, no way. It freaked out. It wouldn't take anything. So we just fed it and gave it water in that position. So it did get better.
Was that an old dog?
Yeah, it was probably, I think it was an 8-year-old. It was like a mixed breed, like a terrier mixed breed. Kind of a bigger dog, 45 pounds or so. So it was a tough a tough case. We sometimes see vestibular disease like with inner middle ear infections. If you have dogs that, if we see dogs that have lots of chronic ear disease, we can sometimes see that happen. We can see it. There's been an association, a loose association with low thyroid or hypothyroidism. I don't know. I mean, you read lots of papers, and I'm not 100% convinced, but if we do see it in older dogs, it's something we can look for. I can't see that I've ever seen a dog that we've treated with thyroid supplementation that I've seen a cause and effect, meaning we get their thyroid up into normal range and then their vestibular disease goes away.
I know. I saw a lot of hypothyroid dogs, and I can't remember one that had vestibular. I know. Probably 50 different other symptoms, but vestibular wasn't one of them.
No. Well, it's more like, if they have vestibular disease, you should look for thyroid disease.
Yeah.
Like, okay, whatever,
Janet in Darien had what'd you have, Janet? Lyme and Bartonella.
Lyme and Bartonella.
Janet.
You as a human had Bartonella?
And who else, Janet?
Oh, Shaggy, our dog, had it 4 times, and our son Kyle had it 3 times. But one time he got the tick. He went to college in Tennessee, and he got the bite there, and he actually pulled the tick off. I never saw a bite. I never had the circle. I just had really bad symptoms.
She was bad, Liesl.
Undiagnosed. It was really bad.
Wow. Now, Bartonella, that's interesting because human Bartonellosis is very often missed. Very often missed. And so it likes to mimic a lot of other human disease processes, immune-mediated diseases, lots of other stuff. So it's, Alice, you probably know this, Ed Breitschwert down at North Carolina State University.
Yes, I actually emailed him. Yeah. Mm-hmm. But Janet will tell you because, and we've talked about this on the podcast before, so I apologize to people, but Janet, tell her about the steroid thing, Janet. I'll let you tell her.
Well, anyway,
Janet's a very active person, and this really brought her down.
But what happened was we couldn't figure out what was wrong with me. Like I was out on my walk. I used to walk 4 or 5 miles a day. And all of a sudden I was dragging my leg like the last half mile. I'm like, this is weird. And then I'd get up and I'd have migratory body pain in my joints, especially in the hip girdle and the shoulder girdle. And so Alice and my chiropractor are the ones who said, you have Lyme. I went to, you have to go, when you go to a human doctor for orthopedics, you have to go to one for the shoulder, one for the knee, another, and I was going to different ones, and they just kept giving me cortisone shots, and it wasn't working. And so it turns out that I had, it made polymyalgia rheumatica, or PMR, active in my body. And I went to the rheumatologist, and she was lovely, and she said, yes, you have all the signs of it. You definitely have it, and we're going to start you right away on, what is it, Alice, what is the...
A steroid, prednisone.
On prednisone. And she said, 15 milligrams, boom, da-da. And I looked at her, I said, do I have to? She said, you'll feel better in about 3 days, and da-da. And I said,
Yeah, you have PMR, not talking about Lyme. But go
and I said, and I told her I had Lyme, because at that point I was diagnosed. And so I said, I don't know what I've been reading about this, is you never come off of it. These patients with PMR are on it for 15 years. They can't taper up. Well, that does happen. And I said, no, I'm not doing it. And she said, well, how are you going to cope? And I said, I don't care if I'm chewing Advil or some kind of, NSAID. I'm not going on the steroids. And she said, you're my youngest patient that has PMR. I was 61 at the time, or 60. And she said, and you're my only patient that's refused treatment.
Because you were the smart one.
Because you were the smartest. You actually thought.
And truly, I was on all those online PMR, whatever they call them, forums, and it was terrifying what people were writing. So I didn't go on. I was taking Advil, a lot of Advil, and I tried everything. I tried aspirin, I tried everything, but the Advil worked, and I would say it was PMR lasts 3 to 5 years, and I had it for 3 years. It ended last.
Yeah, but you left out the part where you went to the immunologist who diagnosed you.
Oh yeah, I went to the
Lyme and Bartonella.
Well,
so you did go. You did go. Okay, and so did Doxy make it better then? Or
I can't do Doxy. They gave me 2 things, and I can't remember what it was. And you go on one for 2 weeks, then you're on both for 3 weeks. So so I did a whole round.
So
of
usually,
that.
it's like if it can be azithromycin with a fluoroquinolone, or like Cipro is oftentimes.
I have to look at my notes because what I did.
It's okay. I mean, It's a very frustrating disease to treat. It doesn't respond with just doxy alone. I just wondered if that was one of the first things, especially with the Lyme diagnosis.
No, but my
Liesl, I
son
have a
and the
question.
dog they treat with doxy, and my son,
Doxy.
remember
But
Alice? He became allergic. My son developed like a whole red rash. He had to stop.
Yeah.
You know, I work with Golden Treasures Rescue, and so we do a 4DX test on everyone that comes in. Okay.
What's that?
It checks for tick-borne disease
Oh.
and that kind of thing. So, okay, so if we get a tick-borne positive and they treat it for a month with doxy and there's no clinical signs, he's not limping, his urinary protein creatinine ratio is fine, say then 6 months later he again tests positive but he's asymptomatic, you don't retreat with doxy, you just keep monitoring that UPC, right?
Exactly. You just
Okay,
keep
thank
checking
you.
for proteinuria.
They were asking me that yesterday, and I know I listened to a webinar on it.
Yeah, you don't have to. I think that if a dog has had Lyme in the past,
Janet, your dog. Yeah.
that if they encounter a deer tick that is carrying the organism, that their body is ready to react. And the tests that we're doing, those SNAP tests, these 4DX tests that we're doing, are not looking for the organism itself. They're looking for the body's reaction to the organism. Okay, so it's an antibody test rather than an antigen test.
Okay.
And so when there's a repeat offender, gets bit by an infected tick, that dog is like ready to go, like, woohoo, I'm going to fight this off. And so I think a lot of times when we have these dogs that are repeat positive dogs, one, you're probably in an endemic area. And two, unless we have clinical signs of disease, I don't usually, treat them. And like Alice said, probably just looking at urine, if there's protein in the urine, then we do a deeper test called a protein creatinine ratio, which tells us whether or not there's chronic ongoing damage being caused to a certain part of the kidney that gets affected by the antibody complexes that are formed in Lyme disease. So,
we could tell Shaggy would have a recurrence because he would get up like an old man.
Yeah.
Very slow and achy, and he was.
So what do you do with that, Liesl? Does that mean the disease is active then when he's...
If they have clinical signs of disease, I probably would treat. So to me, that would be sometime that I may treat. It gets very difficult though with old dogs because maybe they just have chronic arthritis. And then doxycycline, which is the primary drug we use for Lyme disease, it does have some anti-inflammatory effects. And so people will interpret giving the dog doxycycline improvement in clinical signs and say, oh, look, I treated Lyme disease, it's better. When in fact, perhaps we were treating other, joint inflammation with that doxycycline. So it gets tricky to try to define whether it's true Lyme disease or not. I think we probably... I'm of the camp that I don't treat unless we have clinical signs, and I think that there's a lot of places that, well, there's kind of two camps. Some people will treat anytime a dog gets bit by a deer tick, or the dog was a little bit lame, I'm going to treat with doxycycline. Probably not the best antibiotic stewardship. Probably not the best way to go about this. I think we really have to appreciate the degree of Lyme disease in a given area, and then use that information to say, okay, what's the likelihood that this dog is going to have Lyme disease? If you're in Arizona, your dog's not going to get Lyme disease for the most part because the tick population is very low. If you're in the Northeast, if you're in northern Minnesota, Upper Peninsula, Michigan, lots of Lyme disease.
Hey, did you know that for dogs and cats that could benefit from a prescription diet, Blue Buffalo offers natural veterinary diets formulated by animal nutritionists and veterinarians for certain dietary needs like kidney support, weight management, gastrointestinal support, and my particular favorite, dermatology. They make a food allergic diet that's an alligator-based called NP or a hydrolyzed salmon-based for dogs and cats called HF. Contact your veterinarian about these prescription Blue Buffalo diets.
What pets do you have right now, Liesl? Because I don't
So
know.
right now I have that mongrel that I just knocked out of my room here. Her name is Rue. She is, I can't say the word, but you can figure out the acronym. She's our Akron Street Special. So we got her as a bottle fed. baby from a rescue here in Akron, and she's crazy. I love her to death, but she's crazy. And we also have a old, how old is Shadow now? Probably 15-year-old, just black, domestic short hair kitty. He's the best. He's awesome.
How are
And then
his kidneys? Are his kidneys okay?
his
Are you in the
kidneys
same
don't.
boat?
He's due for wellness lab work, but so far so good. But I'm starting to notice a little bit of he's had some chronic GI stuff that I've dealt with, and so but part of that is I have to give him bucket loads of water, so he gets like water with a little bit of canned food and then like kibble floated on top to encourage water consumption. So he's always made lots of pee, so it's really difficult to figure out if he's peeing more than normal and things. So, but that's Shadow. And then we adopted
that litter box. They know that smart litter box that measures how much your cat's putting out.
Oh my gosh! But we have two other cats then too.
Oh.
That are hairless Sphinx cats that I did not purchase. There again, people needed to rehome them because they had a big change in their lifestyle. So that's Smeagol and Bellatrix. So we call them Belly and Smeagol.
That's so
And
cute.
so we have a lot of litter boxes.
Now talk about your enteropathy cat. What does that mean? And what were
Oh,
the
sorry.
symptoms?
Okay, sure. So enteropathy just means a problem with the gut. I mean, that's literally what it means. And when we say chronic enteropathy, it means, okay, it's been going on for in pet years. That honestly means as short as 2 weeks, but usually when we talk about chronic enteropathy in dogs, cats, it usually means onward of, 6, 8 weeks and then months going forward. Chronic enteropathy can be anything from intermittent vomiting, which we see cats do a lot of intermittent vomiting. We can see it as being intermittent loose stool or intermittent stool that has mucus or blood or, basically any change to the way that the dog defecates or cat urinates, defecates, vomits, can indicate that there's something going on in the gut. It's a very long list of things that cause chronic enteropathies, but often, because some of them can be things like I was talking about Patty's dog, my friend who's just diagnosed with this GI, this intestinal mass. It can be that's just slowly growing that then is causing clinical signs that until we go looking for it, we don't find. So yes, it can be a cancer that causes it. Most often we think it's just intolerance or, dare I say, allergy to food or to parts of the foods that they're eating. We attribute it oftentimes, and Alice, you're way better equipped to talk about this stuff, especially with respect to food allergy. We see it oftentimes with protein sources that are in the pet's diet. My cat's problem with chronic enteropathy actually has to do with his calcium level, which you kind of go like, what? How does that work? Which I guess kind of segues into a problem that we see in cats every fairly commonly that I consult on, which is high blood calcium. And the most common reason for high blood calcium kind of across our dogs and cats tends to be cancer, okay? Especially in dogs. We'll see high calcium associated with cancers, the most common cancer being lymphoma, but we can see it with other types of cancers. It is because the cancers themselves secrete a substance that mimics the hormone in the body that tells the body to absorb calcium from the GI tract, and that in turn increases the blood calcium. Now, so when we see high calcium in pets, we have to rule out or figure out, is it a cancer, or is it because of potentially exposure to excess vitamin D. Vitamin D is the vitamin that we all know about sunshine, and you need to get out in the sunshine to get your vitamin D active in your body. But if we see too much vitamin D also works with that hormone that controls calcium balance in the body, and it again tells the gut to absorb more calcium from the food that you're eating. And we get this hypercalcemia. Now, in cats, we also see what's called idiopathic. We're back to that idiopathic word.
No,
Idiopathic
that word. I'm gonna get a bumper
hypercalcemia.
sticker.
But, anyways, so we see this idiopathic hypercalcemia in cats, and we treat it with, there's several different therapies for it, but Shadow, we diagnosed with it, and we've ruled out all the cancers and all the different stuff, and yes, thank gosh. And he's been plugging and chugging along with it for quite a while. Again, that's one of the reasons why the excess water that he's drinking. But with his chronic enteropathy, his clinical sign was constipation, because calcium plays a role in muscle contractility and muscle function. And so when you have excess calcium levels, their muscle function in their GI tract is not good enough. And so he would become stopped up. And we're like, where's this coming from? And that's what led to this big workup.
Wow. So Janet, are you constipated on your calcium?
No, I'm good, thank you. All
Really?
systems go.
No, and I'm the reason, and I didn't say that to be funny, but I don't take calcium because that's the side effect, that and horrible heartburn for me.
But we have a question for you. What is your pet or human peeve?
Well,
It's gotta
pet
be
peeve right now is Rue. She does the boot scoot every once in a while on my carpeting, and no, she's not licking her feet, Alice. So I don't think she has food allergies, but it drives
What's
me
the boot
crazy.
scoot? You mean her bottom?
She's dragging her butt. You know,
Yeah,
Liesl,
everyone.
I have to tell you what can work for that. And actually, one of our fellow vets, Dr. Harris, his dog is doing the same thing. A little bit of ketoconazole, because that rectal area harbors yeast, and the body sets up an allergic reaction to that. So how big is Rue? 50 pounds?
Yeah, about 50 pounds. Yeah.
I would try like a half tablet once a day, just for like a week or two. And then
And
if
see if
that
it makes-
works, go to Monday, Wednesday, Friday.
Okay, just
I mean, there
leaves
can be a
leaves
lot
the-
of stuff going on. You know, there can be
I know.
atopy there, but I'm telling you, a lot of these yeast
Oh,
hypersensitive.
you saw
dogs-
her. You saw her. She is atopic, for sure.
Okay. Well, I
So-
would do a little bit of keto for
And see
ketoconazole, half
that.
tablet once a day. Does she
Yeah,
have a
because I
sleep-
had her on Apoquel for a while, and then I
Yeah.
stopped it. She doesn't scoot all the time. It's only every once in a while, and it
Okay.
always is right before my mother-in-law is going to come visit,
Oh,
It's
well,
a sign.
or you don't know when she's doing it, and then you're like, okay, you have people come in, and then all of a sudden there's like a stripe on the carpet. You're like, this is so embarrassing.
but I bet she's coming because isn't your son graduating from OSU Sunday?
He is. Yeah, my oldest is graduating as my first Buckeye. Well, my first Buckeye kid. Yeah.
Yeah.
He's graduating Sunday, and we're headed down tomorrow to take him out to dinner, and then a long, boring ceremony tomorrow. So that's exciting.
But as
I
you
was
know, in
there.
vet school, we have our own little private ceremony, and that
Right,
was
oath and hooding.
so fabulous, so intimate. But the big one, yeah, the big ceremony, I wasn't, well, I guess because it rained the whole time, so.
Yeah.
I'm laughing because the cat is trying to go out the door and the screen is closed and he's going,
Oh, Janet,
Bumpity
open the
bump.
oh,
door.
he just went like this. He's going the other way.
Oh, all
It's
right.
all fine.
Yeah. The kitties aren't allowed in this part of the house for me because they're a pain. And well, and the one who's graduating, he's got a lot of allergies, and so
Oh, that's
we
right.
have this part of
Yeah.
the house is like at least cat-free zone, and the kitchen is cat-free zone.
But Liesl, my husband and son are allergic, and Alice had me put them on that Purina Pro plan.
The
It
Live Clear,
worked. Yes, that
yeah,
one.
Live Clear. They've been
It
on
worked.
it. They've been on it for years now.
Yeah.
In fact, it's interesting about Purina Live Clear. They
First of all, tell people about Live Clear, because we've not
Okay,
talked about it.
So what Live Clear is it's a
The diet.
food to feed your cat or cats that binds to the fel-2b, I can't remember the exact thing, the antigen, binds to the antigen in their saliva, which then helps decrease the exposure to that in people, which is what is implicated in causing people's allergic reaction to the pet, to the cat itself. So you're trying to grab that antigen out of the cat so less of it is deposited in the environment through their saliva and other things. So it works pretty well.
Percent.
It's working in our house.
Yeah. No, Purina claims it reduces the human allergy by 40%. I thought it was more than that, but maybe 40% is pretty good, you know?
I mean, if you're not like having, anaphylactic, asthma type stuff, I think for really bad allergies, it is, but we're really good about having like the dedicated couch. Like there's a leather couch that I wipe down with like leather wipes that he sits on. So he doesn't sit on any of the, fabric-y kind of stuff that can't be washed.
Yeah, but I was reading that cat dander is ubiquitous. There is some island in the Pacific that has not had cats for 20 years. They eradicated the cats, and you still find the cat allergen there.
Wow.
And the cat allergen is the number one allergen in elementary schools. So, like, if someone brings a cat in as a pet, yeah, I mean, it is like tough to eliminate. So, yeah.
Well, Liesl,
I just love minutia like that.
Well, you mentioned litter boxes, Liesl, for multiple cats, and what we finally did is we bought those Rubbermaid blue bins, like the pretty big ones, and we cut a big hole in the side, and we have two big ones because it has a lid and it's bigger than the enclosed ones you can buy at like the pet store, and they've worked for years. They're fantastic. For multiple.
No, that's great. We have the naked cats came with two. So they have their two that we've kept, and they have they're not like super fancy automatic cleaning ones, but they use silica litter. Oh. And then I have four clumping litter ones, and then another one that's the lightweight clumping. So what is that? 7 boxes for 3 cats,
it's
and
like
it's the only way to keep.
You have
it's ridiculous. And I'm telling you, the one Smeagol. She never covers up her stool when she poops. Yeah. She just lets it out there for other people to cover up. And then if she goes down to use the litter box again and she sees the poop there and she has to poop, she won't poop in that box. Yeah. So she'll poop next to the box. If she sees her own poop.
Way. Yeah, mine's the same way. Yeah, you got to be like, look at those boxes every 2 hours.
Yeah.
I know.
Oh my gosh, we clean them out once a week.
Once a week?
Oh my gosh. Oh.
Yeah, but don't forget, our cats go in and out, so they're doing
true.
The outdoor rest
every day.
Yes.
Every single day.
Yeah.
Like clockwork.
Wow.
Empty the dishwasher, clean the cat boxes.
Yeah. It's like
feed everybody breakfast.
We're like robots. We're like animal care robots.
Right. We live to support their habits. And we provide them with 7 boxes so their litter box habits are good. So
I've always thought, every client of ours or every one of us, we all have our little idiosyncratic. Is that what the proper word is?
Idiosyncrasy.
Of pet duties. You know what I mean? Like if something would happen to me tomorrow, well, who's going to know that she likes her food this way and the warm water on it, and you know what I mean? It's like you have to write a little chart or something.
Right.
Exactly. My husband actually calls the cat boxes the sand trap because on Saturdays he goes, I got to clean the sand trap before
You're lucky you got a man to do that. I don't got no man to clean those boxes. He don't.
You know what else is? I finally got smart because you go to the grocery and you try and pick up that 40-pound thing of the litter.
Oh.
I know just get it delivered. Like Amazon.
I like the lightweight stuff.
You buy enough, you get free shipping, and the poor guy's got to schlep it here, but it sure is easier.
Right now, since we got back from Florida, I had ordered a bunch of litter for my neighbor who watches the one cat that stays in Ohio, and I have 5 different kinds of litter. So I'll get back to you on all those. I don't know why I do, but I do. So I'm working through them, and I'll keep a list. I'll keep a chart.
But what's your human peeve? What peeves you off?
Pet owners who don't understand that a pet lives a long time and that their responsibility doesn't just stop when they're done with that feeling like their responsibility is done. You're responsible. So you should not get a pet if you don't intend on keeping it from birth through its last part of its life.
They are not disposable. You're absolutely
right. And there's so many. There's so many cases. Well, you see it, especially working with the Golden Retriever rescue organizations. We see so many of them that are just, such a cute little puppy, and then they don't train it and they don't develop good habits, and then they end up being turned back into the rescues. I mean, we saw what happened in the pandemic. Everybody rushed out. They cleared all the shelters out. they brought all these pets into their household, and the pets weren't socialized. They didn't, look at it as a lifelong commitment. Everybody goes back to work, and then the pets go to the shelters because people don't have the time to take
The
care of them.
shelters are overloaded. I just saw Ashtabula shelter.
Yeah.
It's horrible. They got in like 50 animals just the other day. It's just horrible. So anyway, Liesl, we love you. We want to have you back because we still have stuff on the list from, pet owners.
Liesl, I got one more thing for you. Alice, you ready? A
1,
minute.
2, 3.
Okay.
Oh.
O-H.
H-I. Oh, yay! Thank you so much, Liesl.
Go
We
Buckeyes.
love you.
It's been a pleasure.
Go
Thank
Bucs.
you so much.
Yeah, we're going to have her on again because she gave us so much knowledge and helped answer a lot of your questions that you're sending us. So that's all for today. This is Dr. Alice Novotny-Chiroman.
And Janet Novotny King saying thanks for listening. Don't forget to like us, follow us, share us on social media, and don't forget to give us a couple thumbs up on your favorite podcast channel. Thanks for listening. Thank you, Liesl.
Thanks.
Bye-bye.
Bye.
Hey, thanks for tuning in today. We hope you found the science-based information provided helpful in taking care of your pet. Check out our other Speaking of Pets episodes wherever you get your podcasts.
We'd love to hear from you. So email your pet photos and or pet peeves to contact@speakingofpetspod.com. Remember to follow Speaking of Pets on all social media.